Ah, now it is.
There it is.
There we go. So it just takes a minute to render, and then I'll introduce everyone. Hey, Rebecca, how did you know that we were both wearing purple today? Okay, we are live on YouTube. Hey, everybody, and welcome to the weekly meeting of the Feel Fabulous group. If you're watching on YouTube, you may not know what that is, so I will put information on the show notes. But this is a group that I've had for several years that helps people with lifestyle changes and dietary changes, and it's a wonderful group. And we meet every Wednesday at 4 p.m. Pacific time, and we have meetings like this with very wonderful guests, many doctors. Dr. Doug Lyle comes once a month and answers questions, Dr. Frank Sabatino. The group's been in effect for almost 3 years now, and people keep saying, I'm losing weight. And what do you do about all this skin? And I'm afraid to lose weight because I'm going to have all this skin. And you guys have been asking and asking for an expert. And today we are privileged to have Dr. Von Maur, who not only is a cosmetic surgeon, but actually the cosmetic surgeon of one of our members who has completely transformed her health and her life. She is my dear friend for many years, Rebecca. She has lost over 200 pounds and she has had these surgeries, and people have so many questions about them. And welcome, Rebecca. Welcome, Dr. Von Maur, and welcome, beautiful lady on the left.
Jennifer.
So nice to meet you, Chef AJ. We've heard so much about you.
Nice to meet you. Well, I don't know. Do you want to start maybe, Rebecca, and tell your story a little bit, and then we can get into the more medical questions with your doctor?
Sure, I will give everybody a brief version of this. So as AJ mentioned, I have lost over 200 pounds. I used to weigh up to 300, I think it was 347 is where I capped out. I didn't get on the scale anymore at that point. That was about 18 or 19 years ago. From about age 19 on, I'm 51 now, I started to gain a lot of weight. And thanks to AJ, I was able to lose the bulk of it, except for the last, I'd say 70 pounds. That was stuck because I was in an emotional eating roller coaster. And about 2 years ago, I had the rug pulled out from under my life with my marriage. And once all of that ended, and I realized that I didn't need to drown in a foot of water anymore. And I wasn't happy. It was actually a blessing in disguise. I stopped emotionally eating and the rest of my weight came off. And at that point, I was left with a lot of skin, because when your skin, or your body rather, is 347 pounds and I'm about 5'5", that is pretty big as far as size. My body was stretched out for about 15 years. That left a dent on my skin, and I had a lot of skin. And it was upsetting because I worked so hard to get there, and then I was left with all of that skin. I went to one doctor and got an estimate on a paniculectomy, which is just basically removing the apron. And when they said to me, well, we're just going to cut that, you don't get a belly button, I realized it was time for me to ask around. And luckily, a very good friend of mine has been here, and she said, you need to go to CosmetiCare. So I said, okay. So I came in and I saw Dr. Von Maur and Jennifer and figured everything out, found out I was a candidate. I was really scared, but I managed to get through that, and we put a plan together, and we'll talk more about the plan. But I basically had 3 different surgeries because I had that much skin. I don't remember how much skin it was, but I think it was combined upward over 20 pounds of skin. But I did lose a little bit more weight after the surgery. Actually, it'll be a year this Friday that I had my first surgery. So that's kind of my story in a nutshell. I'm happy to talk more about that later, AJ, with your group. But basically I lost a lot of weight, went on a plant-based lifestyle. And that's probably what I should have started with. It was a plant-based lifestyle, and it was your program, AJ, because I've worked with you for so long. I finally figured out what the right thing was. I've always known it, but I think what happened is because I was trapped in that emotional eating cycle, I wasn't happy. Once I was set free with everything that happened with my divorce and got back into my own life, I figured it out and I found my way here. I met these 2 wonderful people. They're like family to me now, and I have managed to turn my life around, body, mind, and spirit. And I'll talk more about that later.
That's fantastic. Well, I guess the first question is, did it hurt?
I'm a little bit different, I'm told, only because I didn't take any pain pills throughout the entire process. And with the exception of the anesthesia, of course, during the surgery. But I did well. I did everything that this man told me to do, and I didn't go through very much pain. I think I was blessed. I think I just have a higher tolerance for pain. So I don't know that that's going to be the case for most people, but I think he'll remember me because of that.
Well, what procedures did you have?
You want to talk about that?
You go ahead now. I'll elucidate a bit.
So the first one that I had in December of last year was I think you call it a 360. It's a body lift. So it was basically removing the skin around the midsection all the way around, and it lifted everything. And then the second surgery was my arms. I had to get a lot of skin removed from my arms. That's called a brachioplasty. And I had the back lift. And the final surgery was the thighs. So those were the main areas that were suffering tremendously because of that excess skin. I was able to pull, I had a few friends of mine that would say, "You're thin, you don't need to have this surgery." So I would just drop my pants and pull the skin away from the bone and show them it's not normal for your skin to pull away like this. That's kind of what my skin was doing. So those were the three surgeries that I had.
Wow, that is incredible. So Dr. Von Maur, how long should a person be at their trim ideal weight before even considering these procedures? Because, you know, the recidivism rate and weight loss is something like 98%.
Good question. First of all, I'd like to thank Rebecca and Jennifer for being here. And after Rebecca just got done speaking, I really don't need to say anything, but I will. Okay. Basically, I'll give a brief history. I've been doing body contouring surgery after massive weight loss for about 25 or 30 years. I first learned the procedure from a physician in Kansas City named Dr. Lockwood. He came and gave a lecture. I couldn't believe his results. I had him teach me how to do it. I started doing it 25 years ago. Nobody was doing it around here, so I was the only guy that was doing it. So I got really, really enthusiastic because the patients were so happy. They were relieved. They were carrying this huge burden around with them. They didn't know what to do with it. The previous procedures that were being done were not adequate from my standpoint, as far as contour and beauty. It just wasn't working. So basically, the first operation she had was called a lower body lift. And with a lower body lift, all the excess in the tummy is taken out, the thighs are pulled up, and the buttock is pulled up all at one time. Okay, so the same one operation. That's a very effective way to deal with massive weight loss that occurs in people that we see. Once that's healed, then the second stage we did on her, and everybody's different. We create a plan with each patient individually. So we decide how much we're going to do at one time, depending on the patient's health, their body contouring requirements, how they're put together, their DNA, everything. And the second procedure we did were her arms and her back. She had a tremendous amount of skin excess in her arms and also excess in her back, so we took that out. And the last thing that we did were the thighs. She had a lot of redundancy and excess skin, and they were hanging off of her thighs. So each procedure was about 3 or 4 months apart. We started in December 2020. We finished in July 2021. So she's 2 more days. And it's
1 year anniversary.
It's her 1 year anniversary from getting all this done. She's been a model patient. She's very cooperative. She's bright. She understands the nuances and has been very helpful with us. So I'm glad that she's here to talk about it because she really understands from different perspectives. Number one is the diet, which she changed and which you helped her change, and now she apparently knows how to do that herself and is promising to give me some food that won't kill me. And the reason I like doing these is because these patients are so grateful and so happy. I've had patients where when I take the dressing off, they're so happy they start crying, okay, because they've been carrying this burden around for so long. What is I think your initial question was, when is the right time to do it? It really depends on the individual. Everybody is different. We like them to remain stable near their ideal weight for about 3 to 6 months, but that's not an absolute, okay? They're all cleared medically by their physician to make sure there's nothing major wrong with them. And based on what their timing is and what they want to do and what bothers them the most, that's what we do first. Usually what bothers these patients the most is their tummy and their thighs, etc. And that's the first procedure that we do, and that's what she did.
But do you recommend that they maintain? Okay, the reason I'm asking Dr. Von Maur is I know someone personally that lost 300 pounds and had the surgery and gained 200 back. And I'm wondering, are there ramifications to that when you've already had the surgery? And therefore, do you recommend that they can show you that the lifestyle change is permanent before you do this?
So she lost 300 and gained 200 back. That's very rare. Most of the time that we do these, the patients are so motivated that they don't gain much weight, if any weight, back. They don't want to go through this again. Rarely do they gain weight back. I don't know if the patient you're talking about has had surgical gastric surgery to reduce weight.
No, she lost it on a plant-based diet.
Plant-based diet, which I need to learn how to do. Okay, so she lost on a plant. So when she went back to eating later, did she stay on that particular diet?
Vegan, yes, but not all plant-based diets are equally healthy. Some can be very high in fat and caloric density and processed food. So it is possible to be overweight or even obese as a vegan. So, but my question was, is there a consequence if you've had the surgery and gained the weight back? Something like,
Yeah, it depends upon the surgery, what she looked like before and what she looks like now. It's hard for me to really tell you what we should do because I've not seen the patient. So I really can't make a decision on what I would do with this patient.
right, but I guess the question is what happens to the skin when it's been removed and then a person regains the weight?
If they regain, if after the skin is removed, they're real tight and then they regain the weight, 200 pounds is a lot of weight to regain, then their skin's going to stretch out again. Okay. And they also, before they can correct it, they need to lose weight again so that the excess new skin that's already been stretched out can be taken out. That's pretty rare. In my experience, I've done a lot of these, and it's very rare to have patients do what you just said, but I appreciate your question.
So my question is, it's like,
see you and talk to me about you and about vegan.
right. Well, my question is that I've worked with people on weight loss for many years, and many people do gain the weight back. Even, and I'm not talking about people necessarily that have had surgery. So my question is do you wait, like the minute they lose the weight, do they come to your office, or do you say, hey, let's wait a little bit and see that you can maintain this weight loss before I do the surgery?
Good question. If they get down to near their ideal weight, we like them to be stable for 2 or 3 months. If they're stable for 2 or 3 months, then we can usually trust that they're not going to go back and gain the weight back, although sometimes they do.
Right. When people do regain, if they've had skin removal surgery, does it hurt, or is the skin so pliable it just stretches out naturally again?
If they're totally healed, it doesn't hurt. They just stretch back out. And a lot of times they really don't realize it until they start seeing photographs when they come back and they go, gosh, it looks like I've gained 25 pounds or 50 pounds or 10 pounds. They can tell by the photograph, and they're not even aware of it. It's so insidious. It's so slow.
Yeah. What are the complications to these procedures? Because we have a member who's a male, he's 70 years old, and he's considering a panniculectomy. And he said that he will have lost 150 pounds by the time he has it. He's generally in good health, but he has concerns that he might be too old for this type of procedure. Would somebody that's a little bit older that maybe has had some comorbidities be a good candidate?
Very good question about comorbidities and his age. Chronological age is important, but physiological age is more important. So after complete evaluation by a trusted physician and probably a cardiologist, maybe a stress test and other tests, if he's healthy, then he can have a panniculectomy, okay? The panniculectomy is when you take off the part that's excess and hanging down. It's not a lower body lift because he's 70 years old, so I have to examine him to really get a good feeling for what he looks like before I make an absolute positive decision. But it sounds to me like a great candidate if he's healthy enough.
Right. Now, you operate at a surgery center, right? Not at an actual hospital, but would somebody that maybe has more risk factors want to go to a hospital to have this done instead of a surgery center, if possible?
We have really good anesthesiologists here. They're fully trained. They're board certified. You're monitored the whole time. Aftercare is available to the patient, which we strongly recommend. And Rebecca did that for a couple of days afterwards because they need to be monitored and treated properly. I had one patient who lost weight from 650 pounds down to about 425. She was stable at 425. Her stomach excess skin was hanging down below her knees. We did her in the surgery center, kept her overnight in the surgery center for observation with nurses. And then after that, she was okay. She got to go home. So if the patient is really in good condition, we can do this in a surgery center as long as they agree to have aftercare that's trained that can take care of them.
That makes sense. A lot of people, I don't know if you want to answer this or maybe they can call Jennifer, but a lot of people are asking about price. Does insurance ever cover like Medicare, or does it cover in part, or is this just a completely out-of-pocket type procedures?
I'm so glad you asked that question. I'm even more glad that Jennifer's here to help answer the question.
She
Thank
knows
you.
it all.
It's up to her. Let her tell you.
He leaves me with all the easy stuff. That is a great question, actually, and it really depends. In the industry, Medicare may cover some of the procedures, yes, but our specific group of surgeons are out of network with all insurance companies. We do, however, have a great relationship with Alliance Med, and what that is an outside billing company. So we collect the cash payment up front. And to answer your question about the specific pricing, with the procedures that Rebecca had and almost all weight loss patients, they are in about a range between $13,000 and $29,000. So what we do with patients is we collect the cash price up front. We take the photos and the op report and any notes from the physicians, and we submit it to your insurance as a courtesy. And if they reimburse us, then we reimburse you.
Great, thank you. Fred is saying, could you discuss the procedure, meaning paniculectomy itself, both the pre and post-surgery expectations?
Fred, is that the 70-year-old gentleman?
Yeah, Fred is the 70-year-old gentleman. He actually lives in California.
Hi, Fred, if you're there watching. Okay.
Yeah, he is. He's watching.
If you have an apron, which it sounds like you do, and you've lost a lot of weight, that whole amount is taken out from hip to hip. And there's a low scar way down there. We don't, if it's just a paniculectomy, we don't do anything with your thighs or buttock or anything else. So the recovery is a little bit easier, significantly easier, if we don't have to do a lower body lift. And I like doing paniculectomies on older people because it really helps them a lot. They can get around, they can walk better, they have better balance, they don't fall down as much, they have more energy. Everything about it is good. It's amazing.
What do you do with the skin when you take it off? Where does it go?
It goes into the area where we put different things that we take off. Okay.
Well, no, could you donate it? Like,
And it takes certain tissue out that we don't need.
Right. No, the reason I asked is I used to work at a burn center, and I'm like, could you donate it, the skin?
You can donate skin, but the problem is preparation of skin, and also whether it's going to make a match or not. So we haven't gotten to where we donate the excess skin in these patients. I used to run a burn unit, so I understand that. And skin that's put on me, if I get a burn from somebody else, is good for initial healing, but it doesn't last. It eventually will get rejected because the DNA is different.
Question regarding the recovery time. And for how painful is the procedure for normal people?
For normal people, you're talking about me, or you're talking about Rebecca?
Well, we know that Rebecca didn't take any pain medication, but for the average person, how painful is a procedure like this?
She's not normal, and I'm a baby. Okay, so for me, I take more pain medicine than she did. Okay, everybody's different. We give them strong medications for pain that they take after surgery. Most people are feeling better after about 24 to 48 hours, and they're up walking around and getting better quite quickly.
What's the recovery time, though, till they can resume normal activities?
Depends on what you mean by normal activity. But normal activity, getting up and walking around the house, we encourage that the first day or two, and they keep doing the up and out of bed and walking around. However, if they're heavy duty in the exercise, especially strenuous exercise, then they got to wait 4 to 6 weeks before they can do very strenuous activity. Although prior to that, if they can do less strenuous activity, depending on the individual. We encourage early activity as much as possible, but we're also very guarded about what we actually let them do.
Right. We have a nice comment about you from a live viewer. That's Lisa saying he is very well rated online, and in California, that's hard with all the competition. So that says a lot.
Fred, you're in California. If you get a chance to get out here, I would highly recommend you come see Dr. Von Maur and Jennifer.
Is that Fred?
Yeah, Fred's in California.
Hey, Fred, how are you?
I think Fred's waving at you. So
where do you live, Fred?
I'm in Camarillo.
Okay, well, you're not that far away. In fact, I just operated on somebody from Camarillo, so it's not that far.
And where are you located?
We're in Newport Beach.
Oh, okay.
And this is the type of thing where if you're, I want to take your panis off. I want to do a paniculectomy on you. You come down here after you're cleared by your doctor, and we take it off. You go overnight to a aftercare facility for your own safety, which I think is a good idea. If you're doing okay, I'll come and see you the next day there or the day after that, whatever you want. Then we let you go back to Camarillo after I'm sure you're doing well.
It's I highly recommend that, Fred, only because I went to other centers to get an estimate and talk to the doctors. And it was the people here that convinced me I put forth a lot of time and a lot of money, obviously, to that. Oh, there you go. That's an excellent example. Can you see that? That's a paniculectomy.
Paniculectomy. And the thing that's hanging down is called a panis, and the paniculectomy means we take it off.
Okay, it'd be a blessing.
Yep.
And it's amazing how quickly people do after that and how well they do after that. And it really helps your life. So I'm looking forward to meeting you. Seriously.
Same here. Thank you so much.
It's a joy to make people happy and get them back to a normal lifestyle.
And he means that. He really does mean that.
Wow.
Doing this stuff.
That's incredible. These procedures that you do can only be done under general anesthesia?
You can try them under local anesthesia, but I would never do it in anything but general anesthesia with a board certified anesthesiologist. There are people who try to do big operations under local anesthesia. I would not recommend it.
Not with the pictures I've seen.
I wouldn't even think about it.
The reason I asked you, there's a person that said they have a history of allergic reactions to general anesthesia, and they wondered if there was another way to do it.
It depends on what they mean by allergy. A lot of times people think they're allergic to an anesthetic, but in reality, it's a side effect of an anesthetic. It's not a true allergy. We don't know that. So we have our anesthesiologist spend time talking to the patient to truly find out exactly what anesthetic it is, if possible, and whether it was really a true allergy or just a side effect.
Great, thank you. And how many different procedures do you do? I mean, I'm sure you can do all of them, but I mean, where weight loss specifically is involved, what are the ones that you do?
Okay, the most frequent one is around the midrib, the tummy, which is tummy, lower body lift, or belt lipectomy. That's the most frequently requested procedure because that's what bothers the people the most. Okay, the next thing that bothers them is their arms. And if they're female, is their breast. Okay, so floppy arms. I don't know what better term there is.
Bat wings.
I'm Jewish. We call them Hadassah arms because
how about kimono arms? Okay, so or bingo arms. There's another big people that do bingo. Okay, so if this is believe it or not, this is one of the major complaints that patients have about their body is their arms. You wouldn't believe how happy people are after they get their arms fixed. I mean, it's extremely debilitating not to be able to wear the right clothes, feel comfortable, wear a short sleeve shirt. You can't do any of that if you have whatever it was that you called it. I forget what it was. But
Hadassah arms?
Hadassah arms. I've heard of everything but that. So now I know.
The bye-bye arms, they wave.
The reason is because when you wave, the arm keeps waving.
Yes.
Yeah, it's like you throw a stone out in the pond and it keeps going. Okay.
Diana's calling it bat wings.
Yep.
Bat wings,
That's what I
bingo
called
arms, bat wings, kimono arms, and dasa. What is it?
Hadassah.
Hadassah.
Yeah.
That's good. Okay. So now I know chalas, I'll keep my mouth shut if I see a Jewish patient.
That's funny. So Fred says, should he do any kind of strength training for any length of time before the surgery?
Yeah, I like people to get in shape before surgery, and strength training is really good to do along with cardio because you're going to recover faster and be healthier. It's not about doing bulk, massive muscle mass strength. It's about strengthening the muscle. They don't have to necessarily get larger.
Great. Jennifer, I think you'll know the answer to this because we talked about does insurance pay? And sometimes yes, sometimes no. But let's just say hypothetically, God forbid, a patient had a complication as a result of surgery. Insurance would pay for that, right?
That's actually an excellent question, specifically for CosmetiCare, because we partner with Bliss Insurance. I don't know if anybody's ever heard of that, but we did put him on Rebecca, all of her procedures. In the industry, there's about a 5% complication rate, which is the industry standard. Dr. Von Maur's 3.5, so his complication rate's a little bit lower. He's safety fanatic. If anybody knows him, he's safety. So the rate is low, But just to ensure our patients, we use supplemental insurance called Bliss. And what they do is they insure the patient for each procedure up to $15,000 for their first year. So in the unlikely event you fell into that 3.5% rate, then all of your care would be covered. So if you need another surgery, if you have a hematoma, a seroma, infection, whatever the case may be, you're covered.
That's fantastic. Thank you. Is surgery the only option for the loose skin that occurs after weight loss?
I'm glad you asked that question. There are things you can do for loose skin. And we have energy machines here called J-Plasma that helps tighten loose skin. However, the laxity that we see in massive weight loss patients that you're talking about, it's not going to work. You got to remove the skin. All these patients need skin excision. There's no way around it.
Right. Wow. Thank you. Do you take patients who live outside the country or outside of the Southern California area?
Yes, we see patients from all over the country. It's very common.
Great. If someone can't get to California because they live in another country, how do we know if we have a competent doctor? What questions should a patient ask?
I think the number one question about this type of surgery that they're curious about is this. There's no substitute for experience. No substitute for experience. If you need somebody who's done a lot for a long time, because it requires a certain amount of timing and training and experience to get to where your results are going to be predictable most of the time.
Great, thank you. Are there any risks if a patient were to lose more weight after having the procedure?
I've never seen it. I've never seen the risk of anybody who's already had the procedure of losing more weight.
With my AJ, with my situation, Dr. Von Maur and Jennifer mentioned to me that after the first surgery, since we had more than one surgery planned out, that I would likely lose more weight because that's the pattern you guys see with other patients. And it did happen with me, and it wasn't anything other than, I guess my body was level setting for some reason, but I did continue to lose more weight. I rolled into surgery at about 173, which was 2 pounds under what I thought would be my goal weight. We had the surgery, I think it was 8 or 10.
What are you now?
140.
Wow, you've lost
So-
30 pounds since your 3 surgeries.
Well, you cut some of it out,
Oh,
to be
there you
fair.
go.
But
So I stole some of
I
it from you.
continued to lose weight, and I
What else
didn't
can I
even
take
realize
out?
it. I don't know.
Okay.
We're good. We're done. We're good. But that's what happened. And they did tell me about that, AJ, and I did continue to lose weight, but it wasn't anything excessive. Now, if I could go out of my way to try to lose more weight, but he pretty much put the kibosh on me and said, that's it, no more weight loss. And I realized, okay, so I was introducing the right foods into my diet. I was following your program, AJ, perfectly, but I've introduced a little bit more of the healthy fats, the avocados and a little bit more nuts back into my diet to stay.
Guacamole.
Yes, there you go.
Right.
Holy guacamole. Okay, let's see. Oh, does the surgery you do remove only subcutaneous fat? What about the visceral fat around the internal organs? Do you ever remove that?
I'm so glad that you asked that question. There are patients who come to us and want to have a paniculectomy or a tummy tuck. And those patients that have excess visceral fat, and some of them, that's all they have. You can't take out the intestines when you do this operation. The fat is around the intestines. The omentum is in there. I don't go into the abdominal cavity. So we recommend having Chef AJ teach them how to eat to reduce the excess visceral fat. If there's a way for them to reduce their visceral fat, they're going to get a much better result than if they don't. No question about it. And I hate to turn people down, but if that's their problem, I can't operate on somebody that I know I can't get a great result on, and I can't do it if they have a lot of visceral fat. I wish I could.
Yeah, thank you. Do you ever recommend that certain patients have a psychological consultation before undergoing any cosmetic surgery procedure to assure that their expectations are realistic?
That's a very good question. People ask me that a lot. Generally, we don't need to, because by doing the interview, showing them before and after photographs and telling them about all the risk, benefits, and limitations of each procedure, they pretty much get a full understanding of that. So most of the time, we don't need to send them to psychologists or psychiatrists.
Great. I mean, because there are some people that are somewhat addicted to procedures,
There are, yes.
but you would probably know that after the 10th or 11th operation.
There are cases that we, that we see that we probably can't help much. So we generally defer doing surgery on them if that's the case. There's certain categories like that you just have to be careful that we can usually pick them out ahead of time.
Great. Question on how long does the initial surgery usually take, the paniculectomy?
Paniculectomy is about 2.5 to 3 hours if that's all I do. Okay, now that's not my surgical time. When I get into this with Jennifer a lot and everybody else, that's wheels in the operating room and wheels out. My actual time for just the paniculus is about 1.5 hours, but there's 20 minutes in, 20 minutes out, getting the patient prepared. If it's a lower body lift, I put in 6 or 7 hours if I have to, because I have to change the patient's position multiple times to get the good contour. If you try and do it the old way that I used to do it years ago, I wasn't getting the contour that I liked, because I was simplifying it, starting out with you on your stomach and then back onto your back to do the front. That's great, except you don't get the curves, you don't get the aesthetic result that you're trying to get unless you do it side to side and then on the back. So it's been refined and improved over time. It takes time to do the surgery. There's a lot of work that's involved. I work with other surgeons that assist me because I can get it done faster. And so that's my answer.
You've been doing this, thank you. You've been doing this a while. What improvements have you seen in these procedures over the years?
A lot. I've seen improvement in shape and contour. That's the main thing, shape and contour. And patients I'm seeing a lot less fluid collections than we used to see because of the way that I'm doing the thighs. It's different. I'm seeing a lot less problems with wound healing than I used to see. I'm seeing much better balance and better symmetry than I used to. And that's all because of experience in doing it so many times. For example, if you're going to have a lower body lift, I don't draw pictures on you the day of surgery. I have you come in the office the day before that, and spend it half an hour to an hour marking you, measuring you, marking you, measuring you until it's exact. I take pictures to make sure it's symmetrical, so that on the day of surgery, when I go to the operating room, I know exactly what to do.
And that is really important. I have a friend who had similar surgery, and they marked her up the morning of surgery, and there were some issues with that. And I was in there with you for 2 hours. I call it a Sharpie party because he rolls in with a box of Sharpies and he marks everything up, and he'll bend you and twist you and fold you. It's weird at first because I didn't know what to expect, but at the end you're marked up so much, but you realize, wow, he's making sure. And he's like an architect, because the morning of the surgery, he takes pictures. Morning of the surgery, he came back in and said, I was thinking about it. I want to fix a few things. Took me back in there and adjusted again. He is a perfectionist.
It's really amazing how you think you're perfectly accurate. That's why I take a photograph. The next day I look at it when they're coming to surgery. And after looking at the photographs, I can see little things that need to be modified.
Wow.
It's not like you're going through the airport and having your luggage checked. I mean, there's a tremendous amount of a lot of work that has to be done on them.
Oh my. A lot of people, Dr. Von Maur, are asking about what the scarring is like, and do they fade? Are they long? What are they like?
The scars fade, the scars are long. Every scar gets better with time. It takes about a year. We offer different modalities for scar treatment that we start relatively soon after surgery, usually within a month. And that includes scar gel, scar strips. We have a highly competent laser nurse practitioner here who is really good with scars and lasers. So we do it all. And furthermore, with compression garments that we have you wear for about 2 or 3 months. How long did you wear your compression garment?
I'm wearing
Still
the arm
wearing
ones
them?
right
So-
now.
so-
I wear them anytime I can.
Your arms are done in what, July?
April.
Oh, in April. So she's still wearing her April operation compression garments.
Anytime I can, I try to wear them because you
Scar-
feel naked without them.
Scars are malleable. They're living creatures. And if you use compression, the scars get better faster, and the final result is better.
Wow. I'm looking at the before and after gallery on your website, and you're right. The arms are just really, I can see what you're saying about why people love to have their arms done.
The Khalash,
Yeah, Hadassah. Do more women seek out this procedure than men in general?
In general, yes, they do. Yes. Men are more concerned about the paniculectomy that Fred's talking about, you know. But women, I'm glad women are like women because then I get to do more and create more beauty. And men are more, we're not the same way you are.
Do you offer any non-surgical things that could help us look better, feel better?
Such as?
I don't know. I've heard of some of these procedures like Coolsculpting, and I don't know the names of them, but I've heard of procedures that are done to people that don't involve surgery and anesthesia.
Yes, Coolsculpt. We have a very highly skilled and experienced Coolsculpt here in the office specialist, and she does that on patients, and it's not invasive. They come and they get their treatment. It takes about an hour. Sometimes you got to repeat it a couple of times. And there are certain patients that have localized areas of fat that get better just with Coolsculpt. Okay, and I think it's a great thing selectively. I don't think it's the answer for everything, but there are specific patients that would do well just with that.
Could you please explain what happened to supermodel Linda Evangelista after Coolsculpting?
Oh, I knew you were going to ask that question. There is a complication from Coolsculpting. We've not seen that here. I've seen one with Evangelista that makes two, but it is a known rare complication from Coolsculpting where it's called it's not expected to happen, but the fat grows. It's called hyperplasia, and it's idiopathic, which means we don't know what causes it. And the area that they had Coolsculpt, which was shaped like a triangle in certain areas, just grows a bunch of fat, and it has to be taken out, lipoed out, or excised. And we don't know why. I don't know why. Like I said, I've seen one patient who came from elsewhere. Thank goodness it wasn't our patient, and he had it, and he was angry. And I told him I could help him, but he didn't want me to, so I didn't see him again.
Wow. Karen, who's watching live, says, how much weight loss is considered to be appropriate for surgery? In other words, how much weight does one need to lose before the surgery is recommended?
Who asked the question?
Karen, she's a live viewer.
Which one are you, Karen?
Karen, wave.
It's right there.
Karen.
Yeah.
How much weight loss before she can do this?
Or is suggested, she's saying.
Suggested that.
Karen, feel free to unmute yourself if you want to talk directly to Dr. Von Maur.
Let me know what your situation is, and I can perhaps answer your question.
Well, I've lost 90 pounds, and while I have a lot of loose skin, it's not as seriously bothersome in some ways, but in other ways, it's a whole lot worse. Like when I lay on my side at night, I have so much pain in my sides because I think it's from the loose skin hanging down and being uncomfortable.
Okay, thank you for sharing. So you've lost 90 pounds. What is your goal weight, and what are you at now, if I may ask?
My goal weight was 130, and I'm 132.
Oh, my God.
Oh, nice.
And I lost that at the end of January. So I've been there almost a year.
So you've done exactly what you need to do, and you don't need to lose any more weight. If you've gone from 220 or something, what were you, 210, 220?
Well, and I was at 220, and in March of 2019, I was at 232. So I've actually lost 102 pounds over the last 2 years.
Is that because of Chef AJ, or is that AJ?
Yeah, that's a lot of it. She's played a big role.
Very excited to have patients see her because we need somebody like her to really help people that don't want to have surgery and can't stay on a diet. I mean, you're a you're a jewel, AJ. We really need your help. As far as your name, Karen, did you say?
Yes.
Karen.
Yes.
Karen, I haven't seen your tummy, but I think we could really do a good job on you. If you're down to 132, how tall are you?
5'5",
And how old are you? You can lie if you want to. How old are you?
66.
Yeah, you don't look like it. How's your health?
Great.
Do you have diabetes or high blood pressure, heart disease?
I did before this.
What happened to your diabetes? Did it go away?
Yes.
Good. Then we're ready for you. You're perfect for this. And the thing about sleeping and pulling at night, discomfort, that's all from the traction that the pannus, that excess is doing. You take that off, and it'll be a remarkable improvement. I just apparently Rebecca also had the same thing, which I didn't realize.
I did.
Tell her what happened to you.
Yeah, on any area that had excess skin, which was pretty much everywhere. Anywhere that I would lay, it would go, gravity would take over, and it almost feels like it spills onto the bed. And if I were laying on my right side, I'd feel pressure on my left hip because the skin is already thin from being stretched out. So it was being pulled both on the back side and on the front side. And it got really tender on the hips. It's just, or if I'm lying flat, everything pulls to everywhere is pressure. There was skin, and that was 20 some odd pounds of weight that was pulling on me throughout that process. So I know how you feel after my surgery.
I really notice it when I'm laying flat in the bed, that it affects my butt.
That is a notable disability. That there's a lot of problems with what that happen when you have excess skin. That's one of them. The other one is underneath the pannus. You can get inflammation and dermatitis or chronic infections. That's another one.
I got those too.
Back, shoulder.
Well, and all of that part went away when I lost all the weight. And that's weird because when I was obese, I had a lot of issues with infection and stuff, but once I lost all the weight, it all went away.
Good. That's good. I think I congratulate you. I think that's great. The pulling and the tugging that you have is from the weight and the stretching of the skin, which is easy to take care of. It's easy to fix.
Right. Thank you so much.
Where do you live, Karen?
Huh?
Where do you live, honey? Where do you live?
I'm sorry.
Where do you live, Karen?
Tulsa,
Tulsa.
Oklahoma.
Oh, Oklahoma. All right.
Right. Thank you so much. Jennifer, this is a question for you from Denise. Are the scar treatments included in the price of the surgery, or are they extra?
That's a really great question. Another area where Rebecca is an anomaly in this practice. She has been one of the most compliant patients that we've probably ever seen in the history of our group. Not only is she one of the cleanest patients, but she obviously is diligent wearing her compression garments. She's done everything that she can to get the best scars. But we do offer one free treatment with the V-beam laser after your surgery. Our practice manager has given Rebecca a special crown and has given her a lifetime of laser treatments to help her scars. So she's, again, an anomaly in that way. But most patients, yes, they get the first one for free. And then you can work with our laser specialist to create packages. And then she can let you know how many you're going to need. It's usually about 4 weeks apart until the scar is at wherever you would like it.
Thank you. And Rebecca, many people like Amy are asking if you have any before and after photos.
I do. I mean, I can be the after. I mean, I can stand up in a second here if that helps. But you've seen this before, AJ, but this is probably one of my, I think I was at about 310 there. I really did stop getting in front of a camera after about 300 pounds. There's another one there. I was wearing a size, I think 32 jeans, and I'm not talking 32 inches. I mean, women's 32, which were Lane Bryant and the Avenue, and not in the front where the pretty mannequins were. It was in the back wall where they didn't even bother putting them on a hanger. They just folded them in the back and sent you back there. I was right on the border of getting into 34s, but luckily I discovered some changes in my life and stumbled upon you a few years later. But that's my my before pictures. I mean, as far as my after pictures, I don't know if this helps, but this is me, and I'm very happy, and I would do it again in a second. Sometimes I run into Dr. Von Maur in downstairs in the elevator, and the surgical center is just below us. And I'd always jokingly say to him, if you told me to get in there right now at surgery, I would do it in a heartbeat. If I had to do it all over again, knowing what I know, I would do it.
Wow.
A year ago today, I was scared. I was 2 days out from surgery. I didn't know what to do, but I had Jennifer. She was answering every silly question, every email. She was available to me via text, via call, via email. This team here, if anybody is in the California area or in the US and you can, this is the place to go because of the family feeling here. They got me through this. A year ago, you guys, I was scared. After the first surgery, I got really comfortable. And by the time the planning for the third surgery came around, I was begging him to let me do it sooner. It was at that point where he was like, well, hold on, slow down. Let's not be in such a hurry.
Are you having any more, Rebecca?
No, I'm good. I'm good now. We're good. I mean, if don't ask him that, but I'm good.
Maybe it would be like donuts. Like if you have 11, he gives you the 12th free or something.
Right? No.
This is a new lease on life.
Yeah.
Life change in all
Absolutely.
categories, spiritually, physically, self-esteem, confidence, everything.
That's incredible.
I like to do it because it's so predictable. People are so happy afterwards. That's why I like doing it.
Yeah, I can imagine. So Tracy says, should you have reached your goal weight before surgery, or should you have the surgery when you are, say, 10 to 20 pounds from your goal weight?
Who is that?
Tracy, I don't know if her camera's on. Tracy?
Yeah,
We can't hear on there, but she's there. She's up.
Okay,
There's several
you're
people.
over there on that end. Okay, so the question is, would I do it before she reaches her ideal weight? Like she's 20 pounds more than her ideal weight, right? I would have to see what her current weight is, how much she's lost, whether her BMI, basic metabolic index, okay, is higher than 30.
I'm nowhere close. I started at 360. Today I'm down to 234. I have at least 100 pounds to go. I was just curious with so much, because my stomach's already, liking to introduce itself to my knees. And so I was just curious if I should be right where I needed to be, or whether, you start looking at it, when you're 10 to 20 pounds, since you're going to be taking off pounds.
Yeah, so let's go back just a minute. You start out at what weight?
360.
And you were at 200 and what?
33.
And
Congratulations, Tracy.
Thanks.
What is your goal?
My goal probably is under, I would say 130, because I'm only 5'2".
So you've still got a ways to go.
Yeah, I still got 100 pounds. I was just curious because I know that, like with Rebecca, there's going to be some more weight even coming off with the removal. So that was all I was wondering, if I should start looking at 150, or I really should wait until I'm at the 130.
Basically, I don't think you need to wait till you're down to 130. Okay. It sounds like you're basically healthy otherwise. Am I correct or not correct?
Yeah, no, yeah, nothing, no issues. Everything's corrected since since losing the weight, going whole food, plant-based. And yeah, no, my labs are fabulous.
This is why I try to tell people it's not an absolute, it's a case-by-case analysis, okay? And just hearing what you're saying, you can wait till you get down to 133 or 135, but you can still do it at like 145 or 150. You get the same good result. No question.
Okay, thank you.
Great. Thank you, Doc. So there's a question about breast augmentation surgery, because sometimes after weight loss, women get saggy breasts. And the question is there an alternative to that, because they're concerned about ALCL, neoplastic large cell lymphoma that can happen with breast implant, or even people that have gotten breast cancer from implants. So are there safer alternatives to breast augmentation surgery?
That's sort of a loaded question, but most of the patients after massive weight loss or significant weight loss need to have some kind of a lifting up of their breast, called a mastopexy. The way that you fill the volume up, because they've lost so much volume, is either with fat transfer or implants. The ALCL that you're talking about basically is statistically, it's usually seen in the type of implant that is textured and that is not the kind of implant we use. Sorry. Allergan has a textured implant like this, and that's the one that's been causing the ALCL, so we don't use it. They stopped making textured Allergan implants. with the Sientra textured implant, which is what I'm holding in my hand, you don't see ALCL with this. I don't have a problem with a smooth implant from Sientra, and that's what I use in patients that are worried about it. If they're not worried about it, then we can use Allergan Smooth. But if you're going to use textured, then you got to use something that is not Allergan. Okay, you have to use probably Sientra. So I'm not worried about ALCL with breast augmentation patients at all. And I use smooth implants as a primary augmentation in patients that are having a breast lift. So it's safe if you use the right implant that is smooth. That at the time they have their mastopexy, which is a breast lift, they don't need to worry if they have a smooth Sientra implant or even a smooth Allergan implant.
Great. Thank you. Rebecca, Peter says you look great. Even if you have a few scars, the transformation is worth it.
Thank you.
Who said that?
A live viewer named Peter said Rebecca looks great. And here's a question from another live viewer. What it's about, hold on, I'm sorry. When dealing with an umbilical hernia, can excess skin removal be done prior or subsequent or either?
I like to do umbilical hernias when I do tummy tucks or lower body lifts. I usually take them out at that time. You can do them separately, but it's easier once you're doing a tummy tuck because you can see more. Last week, a couple weeks ago, I did an umbilical hernia and somebody didn't want a tummy tuck, and she's fine. But most of the time, if they have a hernia, sometimes you can't tell ahead of time. I tell them, if I find a hernia, I'll fix it.
Cool. Bonus.
Do you do any face stuff, Dr. Von Maur?
Yes, we all do face stuff.
Yeah.
What face stuff are you talking about?
Well, I mean, because people are asking, can you help people with age-related creepy skin or crepey skin, wrinkles, crow's feet, and marionette lines, whether or not they had weight loss or not?
Question. Wrinkles and marionettes and squinchy lines. We use a lot of Botox here. We use fillers here. That all those modalities help. We have a very well-trained, like I said, nurse practitioner who does a lot of laser work that helps a lot. Microneedling helps a lot. And J-plasma helps for laxity in the neck and the lower face. So we have a lot of minimal invasive or non-surgical things that we can do for the face and the neck before we have to go to a bigger operation. Yes, we do.
Wow, that's fantastic. Well, that's all the questions. Did you guys have any more questions? These were the ones that were sent in advance. This has been very, very interesting to me. Somebody's saying little boobies would be so nice.
We can do that too.
That's amazing. How long, Lori says, how long does the lift last?
Good question. If you wear a bra like you're supposed to, and the implants aren't too big and you have good tissue, it lasts a long time. If you have a very large implant and don't wear a bra or both, it doesn't last as long.
That makes sense. Let's see. Guys can you please talk about the procedure? Okay, this is from Marcia. Can you please talk about the procedure to remove excess skin neck, specifically under the chin, often called a turkey neck?
Okay. That's a major complaint. I unfortunately have one, which I know what I'm going to do with it. But the way that to get it out is to do a neck lift. That's the most invasive and the most definitively effective way. But there is areas of patients, and a lot of patients, you don't need to have big surgery. There's situations where you can lipo the fat and use something called J-plasma or an energy device that actually tightens the skin without cutting a lot. Okay, so that's very exciting. We can also use that for some of the arms and the inner thighs and stuff like that. So depends on what you want. Are you talking about a little fat pad here? Are you talking about really loose?
I don't know. Please clarify your question.
Hi, this is Marcia. Yeah,
Hi.
I've lost about 70 pounds. I have maybe 20 or 30 more to go.
Good for you.
So it just seems like, I see it in my photos, so I'm pretty critical like most of us are when we see our photos, So it's just that section that goes from the chin down to say where your Adam's apple sort of area would be.
Yeah.
So I didn't know if that would need, a full, nothing like a facelift or anything, but is there any way to just pull that skin up once all that fat is gone out of the area?
That's called a neck lift. And we do a lot of those here, and it works really, really well. Just pull the skin tighter with a neck lift. If it's not really severe, we can tighten it with the J plasma. But if it's really severe and floppy, we need to probably do some kind of a neck lift operation.
Great, thank you.
Great. And there's a question, can you get your breasts lifted without having implants put in?
Yes, you can, and we do that.
Rebecca.
Nice.
I had the significant weight loss, and it was significant as far as, the change. I didn't do an implant or anything like that. I wasn't doing it for aesthetics. I was doing it so that it wouldn't be, playing hacky sack with, I'm sure you guys get the image, but it was basically, I was at a point, remember, 347 pounds, folks. So there was a lot of skin there, and it was well worth it. It wasn't, again, no implants, but it was worth it because it's made things easier on my back, first and foremost. That's where I noticed the biggest difference there. And I didn't have I was getting TMI, but getting infections under all of my skin areas. I was getting yeast infections, and I actually had an area of my skin. My dermatologist said that it was like a necrosis, like part of my skin was dead already underneath the skin area. So I had to do this for my health. And that was one of the things that I made sure to factor into our plan.
Great, thank you. Amy says, are there any internal changes like movement of organs with the lower lift skin removal, like your bladder or colon?
What was the exact question about the organs again?
Are there any internal changes like movements of organs with the lower skin lift removal, like bladder or colon?
No, we do a fair amount of lifting of the pubic area because it's usually quite loose, and that does not cause a problem with the bladder or urination at all. And as far as the colon goes, I've never had a problem with the colon.
Okay, great. Let's see. People are asking, like, the scars, do you have to get them the treatment like right after, or is it effective even if they wait a little bit? Is it better to do it sooner than later?
We don't start any scar treatment for 4 weeks, okay? So 4 weeks we use scar gel and strips, and then we see how it goes, and then we, along that line over time, if they need a laser, if a laser would help, then we'll start thinking about laser. So it's progressive.
Rebecca can probably speak to that as well, because she was, again, so diligent with wearing the silicone strips. I mean, every time I saw her, she was just covered in them.
Strips.
So.
After the first 2 surgeries, I was really good. My boyfriend reminded me that I'm not so good with my aftercare, but they have silicone strips. They have everything you need here, and they walk you through it. And I'm learning there's other stuff that can be done now that I'm doing is it V-beam or doing the laser treatments, but they're really easy. It's like putting tape on your scars or putting gel. They have all kinds of different things you could work with, and it's very simple to do. And it has made a difference in the first 2 surgeries. I haven't been as diligent as I could be with the last one, but I'm picking back up on it. But it does work.
Terrific. Can you do non-mesh umbilical hernia repair using Plagets?
I did a non-mesh umbilical repair with suture about a month ago because the patient didn't need mesh. We just opened the hernia sac, reduced it, and then put it and sutured it with really strong, non-absorbable suture, and that's all the patient needs.
Great. Lisa says, how long does it take to get back to working out and physical activities? Maybe that depends on which procedure they've had.
Depends on a lot of things, how well they're healed, what they're going to do next, what exercise they want to do. Usually full-on exercises between 4 to 6 weeks.
It was the first surgery. With my first surgery, that was the only one that cut muscle.
That was
right?
in December. Yeah.
That one was muscle. That one took a lot longer before I could start doing anything. But after the other 2 surgeries were just skin, and it was about 6 weeks for the first surgery. And I think within a couple of weeks from the second and third that I was able to do a little bit more. So it's case by case, but I think it's a matter of how much is cut. If the muscle is cut, you need a little more time.
All patients are encouraged to take walks. I know that's
yes, absolutely.
You want to up the moving.
Yeah, I think walking is probably the most important thing you can do after these operations to keep the circulation going the way it's supposed to, and to keep the cardiac output higher at times. Walking is encouraged right away, and increased walking over time is even better.
That's fantastic. Denise said for the facial things, are any of the fillers not using animal products, meaning are they vegan?
Vegan fillers.
Like Botox is not vegan, right? It's from isn't it from an, I don't know much about this, obviously.
I think Botox is, where's it from?
Just a neurotoxin.
Yes,
Yeah.
I think it's synthetically made. I'm not sure. I think it's, I was thinking about insulin, but Botox could be the same. I know human growth hormone and insulin are both genetically engineered with E. coli bacteria, but I don't know about Botox. I'd have to check into it about
Thanks.
Botox.
Diane says, are blood clots common after these types of surgeries?
Good question. No, they're not. It's pretty rare. And one way, there's several ways to prevent it, and we do it all. But basically, we use compression garments on the legs. We use pneumatic compression machines on the calves. We have patients get up and walk right away, and also early on in their recovery. And thus far, it's been very, very effective.
Thanks. Florence says, does it matter what age you are when you do a facelift? Are the results not as good for younger people?
You want to answer the question?
I think that's a really good question because, you know, and a lot of it is just personal opinion, you know, and beauty really is in the eye of the beholder. So we have patients that come in their early 40s to see Dr. Von Maur, and we have patients that wait until their late 70s. Personally, I think if you start a little bit younger, the results are more natural because you're doing little things over time. If you wait until you're in your late 70s and then you decide to do your first surgery, it typically looks way more dramatic, and then it becomes more apparent that you've had some surgery. So what Dr. Von Maur typically recommends is just little things all along the way to take care of you. So there's not really an age that's better or worse. It just depends on the results that you're looking for. If you want to have a more natural result, if you want anybody to know or not know. And then a lot of it actually has to do with genetics too. There's some patients, I mean, we had one in here today, she was 66 and she looked 45. And then sometimes we have patients that are 45 that look 66. So there's not really a one size fits all as far as age.
Well, that's a great question. I'm glad that she got to answer the question because I'd probably mess it up, but that's the truth.
What about, how do you feel about the sun?
I love the sun, but doesn't like me. I grew up surfing my whole life. I was always outside, and I didn't pay any attention. And we didn't have any sunblock because that was before the war. You know, they didn't have that until later. And I ended up with skin cancer, and now I can't go out in the sun, but I do anyway with a hat with sunblock. I'm white, blonde. I'm a setup for skin cancer. Do I like the sun? Yeah. Do I wish I could go out in it all the time? Yeah. Do I get to? I got to be careful.
But I meant in terms of people that have had work done or that are trying to look youthful.
I usually tell them not to. You know, I know that the ultraviolet is probably one of the most damaging things you can do to your skin. That and smoking cigarettes.
Do you operate on people that smoke? I have a friend who's a plastic surgeon that does a test, and she will not operate on any smokers.
I won't either if they're still smoking. They have to stop for at least a month.
Yeah. Very cool. Do you have anything for aging hands? You know how hands start to look old?
There's all kinds of topicals that we use for older looking hands. We can inject stem cells, and because stem cells from fat has a salutary effect on the quality of your overlying skin. So the most advanced thing that we currently do is injecting stems. We take stem cells from your stomach, we process it, and we inject it into your hands.
Does it hurt?
Not if you're asleep, no.
You're a funny guy. Oh, Lisa says, is sun damage reversible?
Well, I think if you have a good esthetician and you have a good laser person, you have a good microneedling person, and you have good care and good sunblock, then you can reverse some of it, yes.
Can you do anything about varicose veins?
Personally, I think that small varicose veins can be treated satisfactorily with a laser. We have a V-beam laser, the little spider vein things. If they get larger and larger, then you have to consider injections. I don't do that. I did it for a while. I don't do it anymore. And if they're really big, and like giant, then you gotta take it out.
Yeah. Are there,
Relationship with a vein specialist
Yeah,
too,
we
that we
have-
refer patients to.
And I refer them out to vein specialists.
are there any beauty products that you recommend?
What do you recommend for beauty?
We do actually, we
We got
carry a
so
lot
many.
of
We got so many.
medical grade skincare products, and we have a medical esthetician that meets with all of our patients. Anybody that gets a facelift with Dr. Von Maur gets a complimentary hydrofacial. So you'll meet with the esthetician, she'll do a full assessment. She does dermaplaning, which is shaving off the excess old dead skin and hair that's on our face. Then she does the hydrofacial and she infuses you with a bunch of serums, and then she sends you home with a regimen of what you should do morning and night.
She's really good.
Yeah. Well, thank you so much, guys, for your time, Dr. Von Maur. Thank you for giving Rebecca a new lease on life. I mean, when I saw her, I was like, "Where's Rebecca?"
I really appreciate Jennifer and Rebecca being here because they can answer some of the questions a lot better than I can. And I'm happy to get a chance to meet you, AJ, because I left you a message and you texted me back, and I didn't get back to you in time. So I can't wait to see you in person someday. And I'm gonna. Rebecca said that she's going to start showing me what to do because I need to learn how to eat right.
Right.
AJ taught me.
Well, you know what it is. It's eat your damn vegetables. That's what I tell everybody. The main thing, no processed food. No processed food.
It's easy for you to say.
Well, thank you guys so very much. And we'll have all the links there if people want to have a consultation or check out your work. I really appreciate your time. This has been really fascinating. I learned so much. And if you guys liked it, give a wave to the doctor and Rebecca and Jennifer so they can see you.
Thank you so much, AJ.
Yeah.
It was great meeting you.
AJ, thanks everybody.
Hi, everybody.
Thanks so much. Take care, everyone. We'll see you next